part of the whole visit because it sets the tone. So we ask that you start off with some general questions like about school, how's life, maybe homework, before getting to the main point of the visit.
In DC, I have the right to
learn about STIs and HIV.
In DC, I have the right to
consent to sex at age 16.
In DC, I have the right to say no to sex at any age. In DC, I have the right to
buy female and male condoms.
In DC, I have the right to go to any Title X clinic and get free and confidential STI and pregnancy testing. And it's all confidential. Shh.
My piece of advice is to discuss the consequences of unsafe sex. Many adolescents would like to learn about the difference between safe and unsafe sex, but they'll feel more comfortable receiving this information if they're given an opening to consent prior to the discussion.
My piece of advice is on normalizing conversations about sex or sexuality. In addition to talking about contraceptives or STIs, be a resource for those patients who are just beginning to explore their sexuality. Let them know that sexual attraction is normal, and also try to introduce some healthy ways of sexual expression.
So Samantha?
Hey Samantha. Hey.
Nice to meet you. Dad, I'm going home.
So where were you today? You were in school.
Yeah, I was at the doctor's. I had my yearly physical.
How did that go?
Wow. It wasn't the best thing in the world.
What happened?
My usual doctor wasn't there. This lady, and it was like a substitute doctor, and I didn't feel comfortable with him because, you know, it was my yearly checkup.
True, yeah.
So
she saw everything.
Yeah, and it was just like really weird when he was just like checking me out because I didn't feel comfortable with the male doctor.
Yeah, like I can relate though, because like when I go to the doctor, I feel really uncomfortable because like my doctor, English isn't even her first language.
That
So.
sucks.
I mean, well, for me, it's good. We have I have a female doctor, and she's pretty experienced, so it's good for me.
Yeah, I think it definitely helps when they're around the same age because then they can relate to what's going on with you or help you out with anything you're dealing with.
Yeah. Well, at least you guys have good experiences. But is this our set, right?
Yeah,
Good
that's
job.
all.
Alright.
Bye.
Yeah.
Hey, I was listening in on you guys' conversation, and I want you guys to know you have the right to choose with this whole doctor thing, and you have the right to choose where you want to go, who you want to see, what kind of person. So don't let yourself be limited, okay?
All right. Thank you.
All right.
My piece of advice is understandable language. When you're describing a diagnosis to a patient, it's important that you try not to use medical terms or jargon so that they may understand. Also, if you find that your patient is using slang, ask them to explain it, but in a respectful way.
1, 2, 1, 2, 3, 2.
ABCW. The goal of this workshop is to help you. Information, healthy conversation.